We start from tech. We are faced with the most urgent crisis of the COVID-19.
Starting from social distancing and now vaccination, as a global community, we're struggling to overcome this great pandemic.
From children to elders, highly developed internet network as well as the news reports make our society as a whole more alert of the preventive measures, and we can all see citizens with masks everywhere.
But tech that informs us now made a new version of pandemic called infodemic, meaning that fake news spreads faster, and those who are not familiar with digital devices can't get up-to-date information easily.
Our first solution for COVID-19 infodemic is an algorithm checking for the fear and truth. When you read any articles related to COVID-19 around the internet, the chatbot icon will express whether the article is true or not and whether the article triggers too much anxiousness, just like this. By analyzing online newspapers and articles published by unofficial individuals, first, we made a COVID-19 related word list. This list includes how much anxiousness people feel when they watch these words in the articles. Next, to check for the false information, considering that they were all published by unofficial individual, we check for the spelling errors, grammatical errors, and unofficial ending of a word. Last, we check for the word that makes people change their behavior immediately. It is because demanding people to take an action based on false information might threaten one's life, just like holding breath for 10 seconds to check whether one is infected or not. Finally, basic logic of Python code is made based on this standards. Also, we have tested 20 articles, and as a result, most of the articles were correctly analyzed. And by using this result, we have made chatbot icons to express the article's fear, anxiousness, and the credibility. Of course, there are many fact-checking services already provided. However, most current services do not offer easy understanding visual icons and are separated from the original articles, which excludes immediate fact-checking. Also, most services only work for newspaper, even though false information usually spreads through the social networking services. However, our leading program has also its own limitations. That is, it doesn't deliver accurate information. We only deliver a warning message. We also acknowledge this problem, so we try to solve it by devising next solution.
Then what if people can actually engage in combating myths? Inspired by the New York Times visual stories and graphics, we came out with the application that provides various functions that are aimed to increase the citizens' health literacy. We devised a game application that focuses on questions that are worth conveying to let people get necessary information based on the confirmed evidence. So here is our application. If you click this tab, you will see categories of games that developers provided. If you want to play the COVID-19 confirmed cases game, you can click the tab and solve the questions that you'd like to. For example, you can speculate the number of new confirmed cases by playing up and down game. And you can also draw graphs of increasing or decreasing rate of how many patients one medical staff is taking care of. The actual graph and related information will be shown after users complete the questions. In COVID-19 Myths tab, you can play true or false or not verified game, where you can combat your beliefs that might be wrong. We also designed a tab where any users can also upload questions that they want to share, at least if they have any verified information. We hope this application to be recognized as an enjoyable game, not as a static information provider. Why don't you come and join our game? Solve your curiosity.
In this COVID-19 situation, the biggest fear is the possibility that I might have caught the virus. Small fever or slight cough can come as hotter. Thus, being alert on the information as well as following the guidelines is important to minimize the infection. However, for those with digital illiteracy, those who cannot handle the devices well, it is difficult to get access to that information. Most dangerous part is that they might mistake their symptoms as just small illness and therefore spread the virus quickly and broadly. We suggested a solution that connects monitoring system with analyst program. Through smartphone and smartbands, we can now collect data such as temperature and pulse. Plus, with the help of AI speaker, we can now collect and analyze audio data such as cough. All this data will be sent to an analyze program, which will now judge if he or she is suspected of COVID-19. Now that when the person is suspected of COVID-19 virus, warning messages and guidelines will pop up on every first page of the user space, such as TV or smartphone. The point here is that information is now available anywhere and anytime.
In order to prevent misdiagnosis and to provide clear alerts to people of their bodily conditions, we have devised an application. This COVID-19 monitor works perfectly well with the solution we have proposed. In my health report, it will show you how the gadgets have monitored your body with 4 different measures: temperatures, coughs, activities, and heart rates. Each section will show you how urgent the situation is by using 4 different colors. If the system diagnoses the person to be suspected to have cold-like symptoms, it's gonna send out automatic cell phone notification and give you warning videos. Also, the user could choose whether to continue the monitoring mode or not by using this real-time scan mode switch. Since this program gives out automatic warnings, this switch could work as a feedback for a better diagnosis in the future. Aside from these, the app has more diverse functions, like telling you the nearby clinics or giving you health information. However, we cannot ignore the biggest limitation that this solution could only work to people who have the digital gadgets. Therefore, we're planning to enable more people to join by giving them technological aids. We hope this solution would enhance people's health-related situation and improve their overall acceptance of technology.
For budget, firstly, in algorithms accuracy, it should be revised continuously, and this work should be done by humans. This means that there should be people doing data pre-processing work, and they should be paid for that. And secondly, budget for the application should include development, operation, and advertisement. Expenses for application development should include establishment and infographic outsourcing. There should also be maintenance fees too. And as our goal for the app is to interactively communicate with our users, we are designing an advertisement where people can play games or draw graphs. We are thinking of advertisements during SNS, but specific methods can be adjusted in the budget situation. Last, for the electric devices to check for the symptoms, a certain amount of budget should be made. Plus, as we mentioned before, profit would be made in selling programs, and this profit would be used for elder generations, which will make a positive cycle. Our detailed budget will look like this.
Here is a timeline of our plan. It will take place in South Korea for 1 year. For the first 3 months, basic infrastructure for the project will be constructed, like algorithm, game application, and technological gadgets. At the same time, comparing for the change, survey for asking how much anxiousness people feel by media platform and truth people know about COVID-19 will be done. For the next 3 months, the project will be executed in the capital area for a trial to check errors. In July, these errors will be fixed. For the rest of the year, the project will be broadened for the whole country. In December, the same survey done at first will be taken to compare the results.
Our first solution was designed to alleviate people's anxiety about health and to help them find a real truth. Based on algorithm made with Python codes, we made a program that displays accuracy and reliability of internet news through text mining technology. Also, a follow-up game was made to fix and check people's misinformation. Our second solution was devised to deliver health-related information through video in an automated way. Therefore, through the connection between new technical gadgets and common ones, we hope that this solution would make the information more acceptable for everyone and would help aged and disabled people to be able to take care of themselves. Again, we start from tech and end up with tech-free.